Hey guys, it's Dr. J here. Video topic today. Is it possible to have autoimmune thyroid issue called Hashimoto's without thyroid antibodies? I get this question all the time. We're going to dive into that topic here today. Before we do, please smash the like button, really helps. Love to see your comments down below. We'll be answering them as well. And make sure you subscribe so you get notifications of more videos like this. All right, so let's dive in. Hashimoto's without thyroid antibodies. So first off, what is Hashimoto's? That's an autoimmune thyroid issue where your immune system is attacking your thyroid gland. Typically, you're going to see antibodies like TPO, thyroid peroxidase, or anti-thyroglobulin or thyroglobulin antibodies. These are antibodies that are attacking the tissue, and you're going to see inflammation. And then over time, that tissue is going to lose its ability to function and produce thyroid hormone, thus putting you into a more low thyroid state. You'll see TSH increase over time. That's a lagging indicator, so you never want to base your autoimmune thyroid issue or your thyroid health solely off of TSH because it lags 5 or 10 years based on true optimal thyroid health. You want to look downstream at your T4 and your T3, which is your more inactive and active, T4 more inactive, T3 far more active antibodies. We can look at total and free fractions of those hormones. So back to my original question, can we have Hashimoto's without thyroid antibodies? Yes, we can. It's called Sero-negative Hashimoto's, where 90% of the time or so we're spitting out TPO and thyroglobulin. Out of that, it's usually 70-30, mostly TPO, 30% thyroglobulin, sometimes both. I have both, and I can switch higher with one, lower with the other. That can possibly happen. And so you're seeing a systemic immune response, a Th2 or Th1 immune response, where you're making antibodies. These antibodies are then being produced, and they're coming in and attacking the thyroid tissue. That's a systemic type of marker. Those antibodies are found in the blood, draw it out of your arm. They're seeing the antibodies systemically. Now, so with seronegative Hashimoto's, this is happening locally, and you have to look at different markers to be able to assess this to see what's happening. So you're having a localized inflammation where the inflammation's here and it's not going systemic. Quick little article here to look at here, Hashimoto's thyroiditis. This is from a scientific article from, what's it say here? Indian article. Now if we go down here and look down below, I already have it highlighted here, talks about 90% of all thyroid issues, 10% right here are seronegative, where there's no antibodies present. This is really important. The presence of anti-thyroid peroxidase or thyroid peroxidase and thyroglobulin or anti-thyroglobulin is not present, right? And anemia is 30 to 40% present. This is really important too, because if we have low iron or low B12 especially, that could put our blood cells in an anemic pattern, and this may impact our body's ability to synthesize thyroid hormone, because a lot of the enzymes that help make thyroid hormone, at least the 5-deiodinase enzyme, is requiring selenium, and it will require iron to actually synthesize and make thyroid hormone. So very interesting, 30 to 40% of these cases are going to involve low iron, and anemia can mean low iron if it's a microcytic anemia. If it's a megaloblastic, it can also be B12. So we'll just kind of lump them in the big umbrella of low iron and low B vitamins, especially B12 and folate. So really important. So when we see this, we have to look a little bit deeper. All right, so let me go back here. So out of the gate here, does this matter? It does, because when we see an autoimmune thyroid issue, we're treating it a little bit differently. I assume most thyroid issues are going to be autoimmune in nature. There's a handful of studies showing 50 to 90% of thyroid issues tend to be autoimmune. So if you know that you have a 90% chance of someone being autoimmune, you're going to do interventions that are going to help that person and calm down the immune system. When you look at just the thyroid kind of spontaneously combusting by itself, like there's no other input from the rest of the body affecting it, well, then you throw Synthroid at someone, you get their TSH pretty, and then you call it a day. But that does not fix any of the upstream underlying causes that drove the issue in the first place. You have to look at the diet. And so we're going to be making specific dietary changes, cutting out a lot of the more common food allergens, especially gluten, especially dairy. These are going to be big, important things to really get the inflammation down. So really important out of the gate with food. We're going to really go anti-inflammatory, nutrient dense, and low toxin. So very important that we are on top of that. We really want to look holistically at what is happening here out of the gates. And so really important. Now, next thing is we want to look at the gut. Remember, 80% of the immune system's in the gut. So if we have an autoimmune issue, got to look at the gut. It's really important that we look at some of these nutrient deficiencies. Iron, B12, folate, do we have MTHFR? All this matters because we have to get to the root underlying issue. So I never want to assume someone doesn't have an autoimmune thyroid issue, because that may make it so let's say, don't go driving as hard with some of the diet and lifestyle changes that an autoimmune patient needs to make. And so I'd rather just come in there and say, hey, there's a chance that there may be an autoimmune issue. We're going to make these changes assuming that that is the case. Now, what else can we do to assess if there is autoimmunity present? We could look at TSH, of course. Is that borderline high? Is it going 3 or up? Is there T4 and T3 at the bottom half of the reference range, bottom 25% of the reference range? T3 may be below 2.5, 2.7, 2.7. Is our T4, let's say T4 free in the below 1? These are important things to look at to give us an inkling that maybe there's an issue. We can look at other systemic inflammatory markers like HSCRP. We could look at ESR or SED rate, erythrocyte sedimentation rate. We can look at other inflammatory markers and say, hey, there's some inflammation in the body. That's a check mark in the column that there's probably some level of autoimmune inflammation brewing. And so we can look at other markers and see what's happening. We can look at the gut and see how inflamed the gut is too. The gut's really inflamed. Well, we can assume it's probably inflammation at the thyroid because we know the gut plays a big role with autoimmune issues. Now, we can also look deeper if we wanted to look at it locally. We could do a ultrasound and see if that tissue looks inflamed. We could palpate over it. Good doctor that's trained. Here's your Adam's apple. It's going to be about an out a millimeter or so, and then down right here. And we're going to palpate that. We're going to see if it feels flush to the skin. Does it feel boggy? We're going to have you take some water, swallow. We're going to palpate that. Obviously, someone else would do it behind you. They have a better angle, and they'll be able to feel that. You can look at the hormone function, the TSH, and that's a lagging indicator, so you look at the hormones. There's also a needle biopsy. I typically don't recommend that unless you're really trying to rule out cancer, just because it's not going to change what you're doing enough, and the side effects and the inflammation caused by it, it's destroying thyroid tissue. If you already have an autoimmune issue, I don't want to create more inflammation by sticking needles in it unless we're really suspecting something very serious. Then we would just go with the ultrasound, and we would look at some of the lab markers and just try to make some of the changes that an autoimmune patient will be making anyway. Talk about selenium, talk about iron or B12 and folate. And again, iron's different if you're a guy, right? Because guys don't menstruate. So iron issues with guys are less likely if it's an autoimmune issue. And a lot of times if you're vegan, vegetarian, then maybe that would be a more susceptible thing because B12 and iron are really high in animal products. If you're vegan, vegetarian, then you're going to be lower in those. Just keep that in the back of your head. So in regards to the answer from our earlier question, right of our supposition here, can you have an autoimmune thyroid issue without thyroid antibodies? Yes, it's called seronegative autoimmune thyroid issue. 10% can. So either way, you want to dive in deeper because you're going to benefit from all the main therapies that we're going to be looking at to address autoimmune thyroid issue anyway. We're going to be benefiting by looking at the gut, 80% of the immune system. We're going to be benefiting by looking at the adrenals and the downstage hormone system, whether it's estrogen, progesterone, cortisol rhythm, testosterone. We're going to benefit by looking at all these different pathways. Do we have estrogen detoxification problems? Because that tells you maybe when we're estrogen dominant, maybe we're not making enough glutathione, maybe we aren't clearing a lot of our toxins well. Do we have an elevation in beta-glucuronidase? Are we not clearing our hormones well? So if we see hormone detoxification problems, that also tells me a lot. Plus, high levels of hormones not detoxified adequately can increase thyroglobulin, binding globulin, and that can also deactivate or lower your free thyroid hormone levels. It's possible. So you want to look at everything holistically. And so I always rather err on the side of assuming someone's an autoimmune thyroid patient than not, because of all the interventions that we're going to be putting in play are going to benefit that overall inflammatory issue. And if we don't do that and we're too lax, then we may not be able to get that patient better as fast. All right, guys, if you enjoyed the video, put your comments down below. Love to see your thoughts on it. And if you have a seronegative thyroid issue, I want to see your comments there too as well. And if you want to dive in deeper, if you want more thyroid, autoimmune, functional medicine support, there'll be a link down below where you can schedule and reach out to my staff and team. We're happy to help you worldwide on the functional medicine side. All right, guys, make sure you subscribe. Thanks for watching. Take care.